Welcome to Section 3 of the Birth to 3 Program Orientation, Evaluation, Eligibility, and Child Assessment. At the conclusion of Section 3, you will be able to identify the procedures for determining a child's eligibility and the 3 types of Birth to 3 program eligibility criteria in Wisconsin, and compare your evaluation and assessment practices to the required practices discussed in today's training. As a way to keep you engaged in this learning experience, we have built in knowledge checks. A link to the knowledge check will be made available in the chat so you can use this along the way. If you have 2 screens, it may be helpful to have the form opened up on a second screen. If not, simply minimize and maximize your screen when it is time for the knowledge checks. Please note that many of the questions are required and will need to be answered before you submit the form. You will be able to see and save your results after submission. Within this form, you can capture both key takeaways as well as any questions you have at the end of the section. Evaluation and assessment are distinct processes with different purposes. Evaluation is used to determine eligibility for the program. It includes the procedures used by qualified personnel to determine a child's initial and continuing eligibility. Assessment is categorized as the ongoing procedures used by qualified personnel to identify the child's unique strengths and needs and the early intervention services appropriate to meet those needs throughout the period of the child's eligibility. This includes the child's present level of functioning and the family's concerns, resources, and priorities. There are 3 requirements for both the evaluation and assessment process. The child evaluation and assessment must be completed in the child's native language, and the family assessment must be conducted in the family's native language. The evaluation and assessment must be conducted in a non-discriminatory manner, meaning that the instruments or tools used must be selected and administered as to not be culturally or racially discriminatory. The evaluation and assessment must be conducted by qualified personnel as defined in DHS 90. These personnel must use informed clinical opinion in their decisions. Within 45 days after the lead agency receives the referral to the Birth to 3 program, there are several tasks that must be completed by the date of the IFSP. These include screening the child, if appropriate, and a screening hasn't already been administered elsewhere, conducting the evaluation and assessments using a multidisciplinary approach, and finally, developing the initial individualized family service plan. Under Part C, no single procedure may be used as the sole criterion for determining a child's eligibility. According to our federal regulations, the evaluation process must include each of the following: the administration of an evaluation instrument or tool, gathering of the child's history, identifying the child's level of functioning in each of the 5 developmental areas, gathering of information from others who know the child, and the review of medical, educational, or other records. The 5 areas of a child's development that the evaluation instrument or tool is to address include cognition, the child's thinking, problem solving, and learning; physical, the child's movement, vision, and hearing; communication, the child's receptive and expressive language; social and emotional, the child's interactions with others, expression of feelings, regulation, self-esteem, etc. and adaptive, the child's self-help skills. An early intervention team, not an individual, determines a child's eligibility for the Birth to 3 program. That team includes the family, 2 qualified personnel representing 2 different disciplines. One of the evaluators must have expertise in the assessment of typical and atypical development of young children, and the service coordinator. The service coordinator may act in a dual role if they also represent one of the 2 qualified personnel or disciplines. Once the evaluation is completed, the early intervention team determines if the child is eligible for the Birth to 3 program based upon the information gathered. There are 3 ways to be found eligible for the Birth to 3 program in Wisconsin: diagnosed condition, developmental delay of 25% or more in one or more areas of development, or atypical development. Let's explore each of these further. The first criteria to be considered by a team is whether or not the child has a diagnosed condition. If a child has been diagnosed by a physician or other qualified professional with a diagnosis that research shows has a high probability of leading to a developmental delay, the child is determined eligible based upon the diagnosed condition. High probability in this case means results in a developmental delay 50% or more of the time. This must be supported by a physician's report. It is possible that a child with a diagnosed condition is showing no evidence of developmental delay. In these situations, members of the early intervention team use their informed clinical opinion to determine if the child would benefit from receiving services at that point in time. Regardless of whether the child and family receive services, the child is eligible for the Birth to 3 program and may receive services. The Wisconsin Birth to 3 program has developed a chart of diagnosed conditions that meet this criteria as a reference for teams to use. The document, Diagnosed Conditions and Atypical Development Guidance for Wisconsin's Birth to 3 program, can be found within your resources. There are 2 charts in this document. Chart 1 lists conditions in which there is documented evidence that the condition can indeed result in a developmental delay. Chart 2 lists conditions that don't have documented evidence that the child's condition will result in a delay. The early intervention team's informed clinical opinion is particularly important when considering the conditions and their impact in Chart 2. If a child doesn't have a diagnosed condition that leads to eligibility, the evaluation team determines whether or not the child has a developmental delay of 25% or more. This is based on the developmental history of the child, observations of the child in daily settings, and the instrument or tool used to compare the child's 5 areas of development to typical development. To find a 25% delay, the tool would show a 1.3 standard deviation or more below the mean as measured by a norm referenced instrument, or at least 25% delay as measured by a criterion referenced instrument. If the child is not showing a 25% delay in one or more areas of development, but closely approaches the standard of delay, the team's observations may indicate that there is some aspect of the child's development that is atypical and adversely affecting the child's overall development. Alternative procedures to document the atypical development may be used. Based on informed clinical opinion, the team determines the child should be considered as having a developmental delay and thus eligible for the Birth to 3 program. Now, we're ready to check your knowledge. Select the eligibility criteria that best matches this scenario. Record your answer on your knowledge check form. A child is referred from a physician due to a concern in the communication domain. The Birth to 3 program completed an evaluation and a 15% delay was identified in the communication domain. In addition, the evaluation team had significant concerns with the child's social and emotional skills and felt the child would benefit from early intervention services. Here's another one. Continue to record your answers on your knowledge check form. Child was born deaf. One more. Parents were concerned about their child's lack of interest in playing with them or other children. The Birth to 3 program evaluated the child and his score indicated a 75% delay in communication, no delay in the motor, cognition, and self-help domains, and a 55% delay in the social and emotional domain. A few more things to check your knowledge on. Fill in the blanks by matching the correct answer. These are also represented in your knowledge check form. If a child is found eligible for the Birth to 3 program, it's time for more in-depth information about the child and family to be gathered. Part C 303.321 states that a multidisciplinary assessment of the child must be completed. The purpose is to identify the child's unique strengths and needs, and also to determine what services are appropriate to meet those needs throughout the period of the child's eligibility. Part C also requires that a family-directed assessment be conducted to identify resources, priorities, and concerns of the family, as well as services necessary to enhance the family's capacity to meet their child's developmental needs. Evaluation and assessment have distinct purposes and requirements from each other. The processes of gathering information about the child and family in reality actually occurs at the same time, beginning with intake and continues throughout evaluation and development of the IFSP. As a reminder, parental consent must be obtained prior to conducting evaluation and assessment. So what happens after the evaluation? If the child is determined by the early intervention team to be eligible for the Birth to 3 program, prior written notice regarding the decision is provided and an initial individualized family service plan meeting is scheduled. If the child is determined not eligible for the program, the parents are provided with prior written notice regarding the decision. Other options may be considered, and an offer to recheck with the family in 6 months is discussed. Here are a few considerations for your team back home. A link to these questions is available in the chat for your reference.